All right, let's now bring into the conversation Saleem Oweis, the communications officer at UNICEF Middle East and North Africa. Thank you so much for your time this afternoon. Now, reports that premature babies at Gaza's largest hospital, as we've just heard, are being wrapped in foil and placed next to hot water in a desperate bid to keep them alive. Just paint us a picture how bad the situation in Gaza is right now.
Well, the situation has been nothing short but a humanitarian catastrophe for the past 30 days or more. Unfortunately, our fears have been actualized now, and we are losing the children, the infants in neonatal care units. There are over 130 newborn babies in these wards, and many of them are on ventilators. Unfortunately, a couple of days back, nurses and doctors had to remove them from the incubators because of lack of electricity and continue manual CPR on them to keep them alive. The situation is really, really horrible. Until the moment, according to reports, we have over 4,500 children killed, over 8,600 injured and different levels of injury. This is really horrific. The scars, the mental, emotional scars that children are left with, those who survived the violence, could stay with them a lifetime. What we need now, what the children need now, is a humanitarian ceasefire, access for the aid unimpeded and continuous to all kinds of aids, including water, including medical supplies and fuel. That is the lifeline now in Gaza for civilians and hospitals to continue having electricity in these very critical service providing infrastructures.
Now, there are also reports that over the past 36 days, there's been at least 137 attacks on healthcare alone in Gaza, resulting in 521 deaths and many more injuries, as you've also said. How are aid agencies on the ground navigating this? Because we also understand that 16 of those killed are healthcare workers.
That's true. That's according to our colleagues in the WHO. These attacks are horrible. They're not acceptable on hospitals and healthcare facilities. These places should be a safe place for children, their families, and civilians. We need this to stop, and to stop now. The situation in Gaza is really horrible for healthcare providers and also for humanitarians. We are struggling to deliver what we need to deliver to reach children everywhere in the Gaza Strip. That's why it's really crucial to allow access for the aid, but also to protect that aid and protect aid workers, humanitarians, to be able to reach all children everywhere in the Gaza Strip, not only at the borders.
You talked a little bit about, just some of the children and how they're doing. Over 4,000 children have died. I think you said 8,600 injured, various injuries. I mean, we know and we're hearing of some of these children being operated on without using any form of anesthesia or any form of drugs. What are the long-term implications for these children, particularly the ones that are surviving this war and without their parents, and some of them without any caregiver?
Yeah, this is a really rising concern now. Is those children who either are separated from their parents or already lost their parents. Of course, now the main focus is to keep them alive and to keep them safe. But of course, on the long run, that would be something to deal with, to find the adequate care for them, whether in within extended family or in institutional care. But of course, this is far from achievable now. What we are really worried about is the safety of children everywhere in the Gaza Strip. As you said, the emotional stress that these events have on children is huge. We hear from our colleagues, one of our colleagues, she says her young daughter started to pluck her hair and scratch herself to bleeding as the stress becomes unbearable for this child. Unfortunately, this is one story of many in the Gaza Strip. There are over 1 million children living a continuous nightmare for the past 36 days.
Saleem, as we wrap our interview, of course, the WHO also saying that, you know, attacking medical facilities, attacking civilians is tantamount to a violation of international humanitarian and human rights law and conventions. As UNICEF, we know, of course, that this is a war. This is political. Is there anything from your side that you can do in terms of calling for the ceasefire or expediting it?
That's what we're doing on a daily basis, on all levels and at all occasions that we have. Calling for ceasefire, calling for access, and the paramount protection of children that is supposedly guaranteed by humanitarian law. We are doing our best to make the voices of children heard in the international community, but it's the parties to the conflict. It's their responsibility, and everyone who has influence on them. So that's a call through your screen, but also in our official channels. We are continuing that, and we are not going to stop until it's actualized.
All right, Saleem, thank you so much for your time this afternoon. Really do appreciate it. Saleem Oweis is the Communications Officer at UNICEF, Middle East and North Africa.